Good afternoon, everybody, and thank you for taking the time today to join us for this webinar called Senior Health Savings, where we're going to highlight Medico and its portfolio to show you its competitive advantages in the senior health market with Medicare supplements and its entire very comprehensive senior health portfolio. Making the presentation this afternoon is Augusta Norris, an account executive with Medico, and she will highlight Medico's competitive advantages and present to you this presentation. Before we begin, I will let you know that there's an opportunity for questions and answers. To ask a question, just type it into the question box that you see on your GoToWebinar control panel, and we'll address all those at the conclusion of the presentation. So if you want to begin now, Augusta, I appreciate it, and take it away. Thank you very much.
All right. Thank you very much, and thank you, everyone, for being here today. As Rob said, I am Augusta over at Medico. If you have not had the chance to meet me yet, I'm very happy that all of you could make it today. We will be able to answer any questions that you have. You'll also have my contact information at the end of this presentation. So if you do need to get a hold of me or anybody here at Medico, you can do so. Alrighty, so today we're going to be talking about Medicare supplement insurance, and we're going to talk a little bit into the marketplace, and we're going to touch a little bit on competitive analysis, but mainly what we have to offer you here at Medico. Alrighty. So, what is Medico going to offer you here? Hang on just a second here, guys. Sorry. Here we go. Okay, so we have two screens running at once. Sorry about that. We're going to move into the discussion on the consumer side and what we're seeing in our studies versus when we are out there. We're looking through research and what people are actually purchasing and buying out there on the Medicare market. Okay. Sorry, my screen is different from what your screen is showing. So why should Medico be your company of choice? Well, we like to pride ourselves that we make doing business with us as easy as possible. Your success is most definitely our priority as an agent with Medico, and we want to make sure that we can help you through anything that you need, and whether that's industry-leading technology or that's our agent services, it's myself, any of those things are great for us to really pride ourselves on. We do have a full portfolio of products, so it's not just med sups, but that is the main thing you're going to see today. We like to know that your questions are answered, and again, that's myself or that is our agent services team. They're always going to be able to help you in that aspect. So some facts about Medicare. What are we looking for here? And a little bit on the Medicare spending here is this that you see. I always like to point out what is kind of our great opportunities, and a lot of that is the aging in a population and the rising healthcare costs that are contributing to the growth of the Medicare spending over time. And what that's going to be is everything you can see here through the charts. It's going to go by ages. And so the ages that you're going to see is 90 plus, which is that top one, which your smaller numbers, the 1.9 million in 2010, the 2.8 million in 2020. So we're not quite there. So we're kind of in the middle of that one right now. And then you have your ages 80 through 89. That's going to be the orange. That's at 9.4, 10.4, up to 22.9 in 2050 is what we are estimating there. And then we are going to go into the lighter blue. That's that middle section. It's probably going to be the biggest section for you. And that is going to be that 70 through 79. We're getting a lot more close. We're getting closer to where we are going to be more competitive. And then we're going to move down to that bottom one, and that's the ages 65 through 69. And then with this, it's going to show how these numbers are going to keep doubling and quadrupling. And what this is a number of people ages 80 and older will nearly triple. And that's what we want you to see from the years from that 11 million to 31 million. While the number of people in those 90s and hundreds is projected to quadruple from 2 million to 8 million, it's just showing you the rising population and the rising healthcare costs and how they're going to contribute to that Medicare spending. Alrighty, so the next one is going to be another type of chart that we love to share. A lot of this is just arming you with information. This is again the Medicare spending, and Medicare spending was 15% of the federal budget in 2016, and that's going to equal about $588 billion. This represents that 15% of the 3.9 that year, or a better way to think of it, an easier way to think of it, is $1 out of every $7 in the federal spending was on Medicare. It's the same percentage as the defense budget if you look at it that way. So our market is out there, right? Moving on to the Medicare market share, this is going to be the consumer side and the products individuals are buying. So this is what we're actually seeing, not just the numbers of percentages that sometimes gets hard to understand. This is what we're seeing that consumers are buying. So here we're going to break it out a little bit into the market share. 60 million Medicare beneficiaries in the United States. This is going to include the senior Medicaid. That's a lot of people. That means that your options are very, very large and that you are going to be able to talk to a lot of people. 22% of this, or 13.1 million, purchase Medicare supplements. Another 33%, or the 21.5 million, purchase Medicare Advantage plans. The remainder are going to stick with that Medicare. So the number that you don't see here is sticking with the Medicare. There has been a 15% increase in the number of Medicare eligible since 2013. And as you already know, the market opportunity will continue to grow for the next 15 years. And what that means is you're going to see 10,000 Americans turn 65 every day. That means that your options and your market is huge. Your selling opportunity is not going down. If anything, it's going to continue to grow. And that's what we love to see. So why should you enroll in a MedSup versus MedAdvantage? That's going to be the whole thing with today and putting these MedSups out there. What deductibles are covered? Do you want to choose your own providers? These are things you want to ask your clients. There's a healthcare plan out there for everyone. It could be one of the many MedSups options or the MA plans. This is a topic where customers want advice. I always say that they tend to go out to the internet and find their own things, and that's not technically what we want. We want you to arm them with the advice. We want you to be that source of knowledge, really. So we want to be able to provide that to you as well. Medicare 101 is a great door opener. Even if you don't specialize in the senior market, which I hope that you do if you're here today, so that you're even more knowledgeable, you are already helping your customer understand network restrictions, little known out-of-pocket expenses, and deductibles, and many other factors that go into deciding what type of healthcare plan to actually choose, like the choosing of their own doctor and a timeline for changing plans. So see, these are some of the questions that you want to ask yourself, you want to ask your clients when you're going to this appointment. What out-of-pocket or unexpected expenses could be incurred? Do you want the ability to change plans at any time if you're not happy with it? Coverage benefits that stay the same or could change annually. These are things that everybody needs to understand. So let's break down the marketplace just a little bit more. And this is actually a really great graphic, and it's one that I really love to use, and it's one that I like to put out there for people to use. This is an age-in study, and it nearly evenly splits between Medicare Advantage and MedSup, with around 40% leaning towards each product. Those aging in are those split evenly, and the reason for that is that we are actually arming people with knowledge now, and they're getting out there, they're understanding it. The additional 20% say that they will stick with the original Medicare only. Now note that this is a study of these people are different from those 13.1 million, 21.5 million. These are two separate studies. So you're seeing different perspectives, and that's a great opportunity for you to market even better. It's a group who say that MedSup is the product of choice for them who are most certain in that decision. Nearly 60% of that group, of the MedSup group, knows at least one person on Medicare, but they are not sure about that person's exact coverage, which means that they don't know what they're getting into. So they're going to be even more certain that they want to go into that MedSup category, which means that this group, they're not talking about that topic with their friends or family members. So those people with that Medicare Advantage, they might not even understand what they have, and so they're not talking about it. So when you start talking about that MedSup policy with your client, they're going to understand what they're getting into. They're going to pass that information along to their family and friends, and that's going to lead them all back to you as an agent. So it's going to be up to you, right, to kind of put that knowledge out there, really talk to people, get out there. The med sup is important, educate them on that. This one to the right that has the blue and green and grays, this is Plan Choice Certainty by Likely Plan Choice. So yeah, the Likely MA, Likely MedSup on here, or the ones with the original Medicare only. You can see that that first column, the extremely certain, 25% are extremely certain that they want that MedSup. 22% are very certain. The 14, not so certain, because maybe they've heard about it. They don't know, but they just know that that's not Medicare, what they hear all the time. So make sure that we are arming them with that knowledge. Another graphic here. It's always great to see. This is when we asked for 3 main reasons why they would want to choose a Medigap plan. So this is what people are saying for their reasons. There's certain ones that are circled here because they're surprising, and then there's ones obviously like they want to be able to use any doctor or hospital. They're 56% certain that that's what they want to be able to do. 29% want unrestricted access to specialists. We did kind of see that one coming. The one that is a little bit shocking is that 22% want to be able to get care when traveling. So what that says to me and what that says to us is maybe they don't know that that option is available. That could be a great talking point, a good starting point for you. Another great graph to always have with you to make sure that you are very knowledgeable on your subject. All right, so we're going to get into the actual Medicare supplement plans. And one of the graphics that we're going to look at here is this Medicare supplement enrollment. Now, this is a 5-year span, the last 5 years. The last column you're going to see, so if you can see my mouse right here, this column is 2017. So you can see that it's 17, 16, 15, 14, 13. And it's a 22% growth in Medicare supplement enrollments in recent years. So you can see that Medicare supplement is on the rise, and it's rising quickly. Even with the introduction of MAPD plans, due to the large increase in size in the senior population, that is what is attributing to this MedSup plan. You can see that people, now that they're knowledgeable, they're very certain that this is what they want. This is what they're going and getting. This is the information they're passing on to their family and friends. And then it's making the rest of them just as certain and helping attribute to this growth. So why should you sell Medico's Medicare supplement plans? You may not know, but Medicare or Medico has been offering Medicare supplement plans since 1975. So we are well rehearsed in this subject. This is something that we feel that very strongly about. This is something that we think is a great product, and we would love for you to see that too. We have a very knowledgeable staff when it comes to this. In addition to being very competitively priced in the markets, we have seen a lower than average rate adjustment. In fact, that lower than average is about 4.7% over the last 4 to 5 years. So that is lower than the average market rate adjustment. So that's a great thing. We aren't new to this market. Like I said, 1975, so that's 42 years selling this product. We've learned a lot in that 42 years. We have developed this product very well in that 42 years. We believe that that is great for you to bring to the table as well. Our underwriting time is very quick. It's actually about 2 days or less, and you can call the underwriting team directly with any questions. We do call this an underwriting pre-screen, and I will touch on that just a little bit later. But it is a great opportunity for you before you take an application, or if you have questions on an application, it's great to call in, talk to an underwriter directly. Those underwriters also do their own health interview with the applicant, so there's no third party involved, which means that we're going to keep all that information in-house, and it's going to get done even quicker. That's what leads to that great 2-day turnaround. All right, so a question you might be asking yourself is, well, with this product, where is it even available? What's the great part about it? You can see here in the blue states, all the blue states is where it's available. Just depends on whether or not it has a household discount. And what the household discount means is that your client is going to live with someone who is 18 or older. Now, that person they live with does not necessarily have to sign up for coverage. They just have to be living with them. It can be a 7% household discount or 12%. So if you're here in Nebraska with Art Jetter and Medico, you see it's a 12% household discount. That's It is great. That's about top of the market there. It's a great discount, and we want to make sure that you offer that to everybody. Like I said, they just have to live in the household with someone over the age of 18. On our My Enroller, it just asks for that person's first and last name that you said that you live with, so that's always a great opportunity too. You don't have to get a ton of information on them. Keep in mind there are a few states, Ohio, Pennsylvania, Illinois, that does have regulations. Those ones just stipulate that both individuals in the house must apply for the discount to be applied to them. So that's why they're just a little bit different, but they still will get a household discount. Okay. So I kind of touched on that underwriting feature, but here are some of the general health applications questions here. You'll see that it does give you that timeline. So within the last 5 years, have they had diabetes requiring insulin or with complications? Advised to have a bone marrow organ transplant. Within the last 2 years, have they had internal cancer, leukemia, melanoma, Hodgkin's or lymphoma? You can see if you go through the list here that you can get down to the bottom. Do they have Alzheimer's disease, senile dementia, organic brain disorder? Are they currently using oxygen? This is our underwriting philosophy that we are right in the line with other carriers or middle of the road. We don't want to be too strict, but yet we don't want to be too lenient. If you're too lenient, then your claims go up, and nobody wants that. Great part is every month our underwriters do hold a webinar, and we change the topics every time. The one that we just did was over diabetes because we do get a lot of questions on diabetes, and that's where a lot of our pre-screens come from. With that pre-screen, you call in, you talk to an underwriter right then. So if you call in and say if you have a question about diabetes that requires an insulin or it's two kinds of injectables, they are going to answer your questions right then. Or a great one that comes up a lot is my client uses a CPAP machine. Is that considered using oxygen? The answer is actually no, it is not. But that is one that we got a lot of questions on pre-screen, so we started reaching out, and it's something that if you call in and ask those questions, it helps us better our product and better our process. So I really encourage you to take full consideration of that when you're using it and call into those underwriters with all of your questions. Okay. So what are some ways that you can save on monthly premium? Now, we always know our options, and we always want you to know the options. There are always ways to save on monthly premiums, and this is the difference between the three most popular plans. The main point is to see the difference by reducing benefits just slightly, and that would be that Part B deductible. You can see Plan S, Plan G, which is our most popular, and Plan N. I'll usually stick with Plan G when I go through most of this and use my example. So you can see here, it's $907. They add the Part B. If you wanted to add the Part B deductible, it is $185 for 2019. For Plan N, the Part B excess charges are not covered. Physicians who don't actually accept Medicare, they do have the option and the right to charge up to 15% over the Medicare-approved amount for services. However, this is extremely unlikely to occur, and we do not see it very often. And there is up to a $20 copayment for office visits and a $50 copayment for ER visits on Plan N. That's just to keep in mind when you are looking at these. However, the annual premium savings between F, G, and N is outweighed by those deductibles and copayments. So I'm going to stick with Plan G for the most part. When I go to this next one, this is ways to save on monthly premiums. This is a chart that shows those additional deductibles and copay amounts. Even after you add the $185 Part B deductible, that's going to equal about $331 that's left over from Plan N compared to Plan S, that's the math here, and $256 left over from a Plan G compared to a Plan F. So you can take those savings that you're getting by taking the Plan G, you can add those Part B deductibles into those, or the Plan N, you can add that Part B deductible and the 2 doctor visits into that and still save money compared to a Plan F. So it's always something to keep in mind when you are out there. This is another one I always say is a great chart to have when you go talk to those clients and what that they should be buying. Okay, so let's get into where your focus should be. It's important to note that Medico is priced competitively at age 68. 68 and up is where we are rock star. That's most states. We can always get those rates out to you. We're looking for those policyholders who are switching from a different MedSup plan to save money or that Medicare Advantage, anything like that. 68 and older, that's where Medico is going to be. Let's look at some key states, though. With saying that and saying most states, let's look at some of these key states. These next few slides are very useful for you to focus your efforts. So again, I'm going to encourage you to keep these slides to help you focus, look at them. You get in one day and say, where am I going to start today? Okay, well, I'm going to look here and see what Medico has. Where is my focus? Where is my demographic and what plan? So there's about 15 key states. This is a conservative view, so there should be additional areas for male or female, and there may be additional age ranges, but we are just showing the data as streamlined as possible to give you that great idea. Age range focus, you'll see that in here. We offer competitive rates to focus on each state. In some cases, it may be the entire state, and others may be more specific to metro areas. And these are also in alphabetical order. It's not in rated order, or it doesn't necessarily mean that Colorado is our number one state. It's just in alphabetical order. So Colorado, male and female, ages 67 to 85, plans G and N. That's where we're going to be at. That's where we're the most competitive at. That's one of our great states. We are ranked in the top 5 or within $5 to $10 of the lowest rate in these ones that you're seeing. Iowa, I will say, is one of our best states. We are most likely across the state number 1 in male and female, Plan G, 68 through 85, also Plan N. We have fantastic rates. Illinois, you will see here in that demographic how it's a little different. It's that majority female, ages 71 to 85, so just a little bit above 68, but not much. Kentucky, also majority female. Let's look at the next one here. So we have Louisiana, male and female, Plan G. You can see that Michigan is going to be male and female, 69 to 80, Plan G and N. Same with Ohio. Ohio is a fantastic state. Oh, and Nebraska. Can't forget about Nebraska. We're awesome here also. Male and female, 68 to 85, Plan G and N. Ohio is going to be mainly Plan G, 68 through 85. South Carolina, that one is 70 to 85. I will say that the one of the best age ranges there is about 72. That's where it's going to be fantastic. So we'll look at this next page, and we're going to start with Tennessee, male and female, and this one's a little bit different because it's Plan N is our best one there, 72 to 82. Utah is a very underrated state. Medico is number 1 in so many areas in Utah, and we encourage agents to get out there and get licensed there and start selling because it should be a state that's penetrated a lot more, especially that Plan G, ages 70 to 85. Virginia is a great state, male and female, 72 to 85, so you can see that it's a little bit older as well, but those are great rates in that range. And in Wisconsin, you know that the plans are just a little bit different. You have that base plan, but Wisconsin is one of our number 1 states right now, and it was for a general amount of last year as well. Again, we can always break these down by zip code, so if that's something you're looking for, you want to see exact zip codes of those states, we can do that for you, and we can give you the difference between us and the next person, and we can give you rates for those. Alrighty, so cross-selling with MedSups. Many of your clients believe Medicare is actually going to pay for expenses associated with dental. That's going to cover those majority of dental services. That's not covered here. All costs associated with cancer diagnosis or short-term recovery care, but you should know that that's not the case. First diagnosis cancer, not all cancer-related costs are covered by traditional health care, such as travel, experimental drugs, lost wages, etc. So you can go in and put a first diagnosis cancer plan with them. It's very easy to qualify for, about a 99% issue rate, and there's only 3 questions on the application. So I encourage you to take a look there. When you find the opportunity to save your client some money on their MedSup coverage, you can use those funds to offer coverage to help reduce those gaps even further. You can do this during the MedSup sale, so maybe if you only sell MedSup during AEP, which you don't have to. You can actually sell these all year long. Or if you want to do a follow-up. So if you're doing some follow-ups this first quarter, You can start going back and doing those cross-selling. Maybe you want to look at that short-term recovery care. Skilled nursing facilities, stay-at-home health care aren't covered by Medicare, but they are in our base plan. This is a less expensive option to traditional long-term care. Traditional long-term care, the underwriting is getting very stringent, and it's a lot harder to qualify for, but short-term care is actually very easy to qualify for, and skilled nursing facility and home health care are offered in our base plan. But when you go out to do that cross-selling, you probably want to know what's the easiest way to actually cross-sell. At the beginning of the presentation, I touched on our industry-leading technology, and that is our My Enroller. And that's not just from me, that's from agents all over the board and companies. They love the My Enroller. It's so easy, and I highly, highly encourage you, if you haven't used it, to try to use it. You can do electronic or voice signature options. You can take the application face-to-face or over the phone. You could talk to somebody like I'm talking to you, and you can take that cross-selling application. You can use it with or without internet connection. You can use it on desktop, laptop, iPad, so whatever you have, you can use it. You can do the multiple applications at the same time. So that's that cross-selling opportunity. And how that works is, say that I want to, this is the first screen that you'll see. So say that I want to use a Medicare Supplement Plan G. I'm going to click here, and it'll put a check mark. It'll do my preferred effective date. It'll give me monthly, so I'm going to pay monthly, or bank draft, and then my amount, my premium amount. And then say, well, they also want to do a dental, vision, hearing. So I'd come here, and I'd check the box for dental, vision, and hearing. It's going to do the same thing, give me my amount. And then down here at the bottom, it's going to tell me my premium total by month. So it's going to give me my total right then. And that's going to hold true through the whole process. As you fill this out, I'll tell you now, it takes like 5 to 10 minutes to do 2 applications. It integrates the questions together to make it easier for you. About 68% of our applications do come in via My Enroller, unless it's hospital indemnity, and that's about 86% of the applications. So a lot of people are using it. And I would say that the reason that they are is because it easily transmits applications to Medico, so as policies get issued quicker, and that means that you, as an agent, you get paid sooner. And that's what everybody wants, correct? So, one last thing before I let you go here, and that is, speaking of getting paid sooner, this year we have officially announced our agent bonus incentive here, and this is going to be on a monthly payout. It started last Friday, so March 1st, so anything you have sold, or if you haven't sold yet, you're going to get paid for as soon as you hit 6 applications. That can be of any product combination. So all 6 of them could be underwritten med subs, and you'll get paid $600. Or you could do 4 Medicare supplements, 1 hospital indemnity, and 1 dental, and you'll get $450 for that month. You can qualify each month. So the possibilities are endless. I know that last year we had a fantastic outcome. A lot of people love this incentive, so I encourage you to take a look at it. I know Art Jetta will be more than happy to give you some information on it. But this is all you have to do, 6 applications, any product combination, all in the same month, and the money is yours.